Hey everyone, and welcome to the FLATLINING Podcast from Fulcrum Strategies. I'm Matthew Handley with our President and CEO, Ron Howergan. Ron, how are you, sir?
I am doing great. I hope you are as well.
I am doing well because I don't live in Baltimore or Kansas City or San Francisco, and so I am one of the many well, I've been a Lions fan for a while now, but we are now joined by, I think, the majority of America rooting for the underdog right now, which is the Detroit Lions in the NFC Championship this weekend.
Yeah, well, it's because, something happened this weekend that has not happened in my lifetime.
Yep.
And that's the Lions have won 2 playoff games in a row. Mm-hmm. Because the last time that happened was 1957. Yep.
And
so, yes, I'm in good shape as well for that.
Yeah, I'm excited. I'm excited because, I think our listeners know I live in northern Michigan, but it's not always that every weekend we have the Lions on TV because there are a lot of Green Bay fans up here, so they actually have a lot of Green Bay televised games instead of the Lions. But now that they're in the playoffs, I get to see all of them because they're all national games. So I'm excited to see the Lions take on San Francisco. I did see a price in the Detroit News for some of the tickets and flights, and I will not be going. As well as we do at Fulcrum, Ron, I don't make quite enough money to justify going to that game, but
you and me both, brother.
I will watch it from the comfort of my living room with a beer and on my couch. So
absolutely.
All right. This isn't a sports podcast. It's a healthcare podcast, believe it or not. So let's talk healthcare. And the thing we're talking about today is something that I think patients hate and providers hate. And that is, of course, prior authorizations. Ron, we have talked at length about prior authorizations over the past year, in particular with the story of Dr. Dan Hurley, because it was a prior authorization that ended up getting denied. That I think you can't say it's a necessarily a one-to-one coincidence or a one-to-one consequence, but I think it is reasonable to say that in a sense cost him his life because he was not able to get perhaps the appropriate cancer treatment he needed. So one of the things that has happened a lot lately is we've seen a lot of lawsuits against the payers for these excessive denials for care that should be covered. And recently, the Biden administration, under the Centers for Medicare and Medicaid Services, has issued a new final rule that goes after prior authorization. So can you give us a little bit of a background at what this does and what kind of plans it affects?
Yeah, so it's basically a rule that requires payers, health insurers, who are participating in Medicare Advantage, Medicaid, or what they'll call the Obamacare exchanges. So those 3 products, it requires that those payers must respond to an expedited prior authorization request. This is something that's urgent in nature. They have to respond within 72 hours to those and to standard requests within 7 calendar days. So 72 hours or a week, they've got to respond to that request for prior authorization. They can't just sort of let it linger there. It also has some other rules around it saying that if they're going to deny something, they have to include the specific reason for the denial. And then they're also going to have to publicly report some prior auth metrics, how many times they're denying things, what their turnaround time is, et cetera. So that's roughly what the law does. And like I said, it helps the Medicare Advantage folks, Medicaid, and then those people that are covered by one of the Affordable Care Act exchanges.
Let me ask you something that may be a distinction without a difference, and that is that you said that the health insurance that participate in Medicare Advantage, Medicaid, or the exchange plans, does that mean all of the products that they offer, if they sell one of those, fall under this new rule, or is that only the products that you just listed there?
No, it's only those products.
Okay.
And part of that has to do with, the way the Biden administration did this, they can only touch those products because those products are funded by the federal government through CMS. Roughly half of the country, about 153 million people, are covered by either private or employer-sponsored health insurance plans. Mm-hmm. None of this applies to them. And it's because that they really can't forcibly apply that without actual legislation that touches those. So, if you're a Medicare Advantage plan, if you're Medicaid, if you're under the exchanges, hey, this helps you. For the rest of the other half of the country, it doesn't do a thing.
Well, and at least at the bare minimum, we could say this. You're right. That this is a success for some of the people that are on those plans, because there are quite a few Americans on those plans.
Sure.
Let's take a step back then, because since it doesn't help those that are on self-funded or employer-based insurance, basically, either self-funded or fully insured, who then has the ability to regulate those plans and say you need to do prior authorizations within 72 hours, like the CMS rule?
Well, the legislature could do it for the self-insured. They'd have to pass legislation that either attaches to the ERISA legislation, which is where they're funded under, or standalone. They could also apply that to fully insured, but they've got to be careful they don't step on states' toes. And individual states could do it for fully insured. So it would either be state and or federal legislation rather than sort of regulation.
Mm-hmm. There's a second part of this rule here, and now we're getting really into the weeds with it, but I'll ask you about it anyway. And that has to do with the electronic prior authorization measure for clinicians that are under the merit-based incentive payment system. What is that? First of all, what is that merit-based incentive payment system? Is this one of those situations where Medicare's trying to get away from fee-for-service?
Yeah. It has to do with folks who are under the ACOs, affordable care or accountable care organizations, et cetera, under Medicare. And it's a pretty technical part of the bill on what they have to do electronically through there. The other thing to keep in mind, and this really needs to be pointed out, there are two other concerns I have for what they're doing here.
Sure.
And don't get me wrong, this will be a lot like the discussion we had on what they were trying to do to bring down pharmacy costs. Mm-hmm. Hey, it's a good step in the right direction, but it's a baby step. Yeah. And let's not overestimate what it'll do. The two concerns I have is, first of all, they have to respond within 72 hours or 7 calendar days. It doesn't say they have to make a determination. They have to respond. Okay. So technically speaking, if you have an expedited, let's take Dr. Hurley's situation. Mm-hmm. Okay. What his doctor was saying is, I need this PET scan because I need a baseline number so I can tell whether the treatment I'm giving him is helping or hurting. And I need it right away because we need to start him on this chemo right away. Okay. Well, the response could be, we would like more information. Could you please answer the following 37-page form? That's a response.
Yeah.
And if that physician fills out the 37-page form and sends it back in, they have another 72 hours. Okay.
Right.
Or we haven't seen the chart notes for this yet. Please send those to us. That's a response. So it doesn't mean they give a decision or determination. It means that they just respond. Okay. So that's one concern that I have. Mm-hmm. And doctors all over the place will argue about, hey, I send this in and then they give me back 12 more questions, and I send that in and then we lost your response to that kind of stuff. The other is, I'm a little worried about enforcement. What's going to happen and who's going to enforce it, and what's the penalty when it's at hour 73 and I don't have a response? We've got a number of situations. The No Surprises Act is a perfect one where the federal government has just chosen not to enforce it. So who's there? Who's the police officer, so to speak? How bad is the ticket? Because without enforcement, it really doesn't even matter what these rules are. So again, it's a good step in the right direction. I like what they're trying to do, but let's not pretend that this is going to fix this issue or even really have that much of a material impact on it.
It's funny you mentioned the enforcement mechanism. We talked about that last week in the state of Pennsylvania, where they have that new website where you can appeal your denied claims. We asked the same question. What is the enforcement mechanism for that particular website and that system? And we've heard from the Biden administration and Secretary Javier Becerra talk about how many warnings they've sent out over not just the No Surprises Act, but the Hospital Price Transparency Act and some of those as well, that they have just not done well at enforcing both. In part of it, I'll give them a little bit of the benefit of the doubt that at least for hospital price transparency, they're not equipped to do it in the way they should. But, for No Surprises, it's been blatantly obvious that they've just decided not to enforce it. Go ahead.
Yeah, I mean, I think in general, it's obvious we're in an election year. This is a nice election year thing to do, and again, it's going to help some people. So I don't want to, but it really is almost Band-Aids on bullet wounds. I also thought it was interesting that here's a regulation and CMS putting out this regulation. And immediately there was a joint statement by several senators and representatives going, yeah, this is great, which I'm thinking, well, that's fantastic. You guys didn't pass legislation. This was a regulation. And talk about finding a parade and jumping in front of it. You know, if these guys really were worried about that, then let's get to work and pass some really meaningful legislation, including enforcement. I mean, do something like OSHA does with workplace safety and put some teeth to it. But no, we really don't want to do that. We just want to pretend like we're fixing the issue.
And you're referring to Larry Bushin, Republican of Indiana, Mike Kelly, Republican of Pennsylvania, Susan Dilbane from Democrat of Washington, Amy Barra, Democrat of California, plus several other senators.
Right.
And you know what I noticed about that list of names too, Ron, is that none of them are the ones that we would typically point to as saying, hey, they're talking about health care in Congress, because that's usually Jan Shankowski and Bernie Sanders, and occasionally Rand Paul, depending on what side of the political spectrum you're on. But it's none of these people are big healthcare hawks in the Congress right now.
No, none of them are big healthcare in Congress right now. That's not who you would think is the normal cast of characters that take a pretty hardcore healthcare position. And several of them are probably in a iffy political position in the next election. So I could see them doing the whole let's find a parade and get in front of it and see if I can use this as a soundbite on how I protected patients against evil insurance companies. I also think the insurance companies know that this is a pretty minor inconvenience, which is why I don't think they really rallied against it. Without much enforcement, Medicare and Medicaid tend to have less of this problem anyway. I think the payers view this as this is a parking ticket rather than a felony.
And I had the same thought only because there didn't seem to be any statements or anything put out by the insurance lobbies that represent some of the interests of the big insurance groups in Washington. It's an interesting thing. As to recap, it doesn't apply to private employer-sponsored insurance, about 153 million. It doesn't apply to Veterans Affairs plans. It only applies to Medicare, Medicaid, CHIP, and Obamacare plans. But, like you said, step in the right direction, but not a big step.
Yeah, exactly.
Ron, really quickly before we go, we have talked a lot with our clients about what is going on with Medicare, and I know we talked about it last week. I just want to see if you could give us a little bit of an update before we go today to see if there's any movement in that direction, what physicians should be planning on at this point. If they're holding claims for Medicare, should they release them?
Yeah, so the only movement is sort of disappointing no movement. One of the big chances that we had to potentially get rid of some or all of the Medicare cut, the 3.37% cut in the conversion factor, was if they could attach it to the legislation to keep the government running. And it didn't get attached there. That spending or continuing resolution doesn't have anything in here about that. Getting rid of that Medicare cut. That's unfortunate because that was probably our best avenue to get something happening very quickly. So now, if they're going to get rid of some or all of it, it sort of almost has to be standalone legislation. That's going to be problematic in this Congress, both in the House and in the Senate. So if I were in Vegas right now and I had to bet money, I would probably bet better than 50% odds that the whole cut stays. I hope I'm wrong. I hope Congress pulls their collective heads out of their collective rear ends and stops punishing doctors. But I'm worried that this one's going to stick. Yeah. And that's really, it's really problematic when you realize that means that's two cuts in a row. The last one was 1.5 or so. So they've cut physician reimbursement by little over 5% in the last 2 years when we've been facing horrible inflation. It's just hard to wrap your head around why that would be occurring, and eventually we're gonna pay for it. So to answer your question, if I were a medical practice right now, I'm not sure I would hold Medicare claims. I'd go ahead and submit them because I just don't think they're gonna take away this cut, and that's really unfortunate.
Well, I hope even if you were a betting man and you had money down, and I'd still hope you'd be wrong too, just for the sake of our clients right now, because that's a repeat question that's been coming up, and I'm sure it has been for your clients as well.
Yep.
Well, Ron, we're just about out of time. Thanks again for sitting down with me and having a conversation about prior authorizations today.
You're very welcome. Enjoyed it.
Miss an episode of the Flatlining Podcast? Well, now you can read a recap. Just go to flatlining.net and look right there on the homepage every Monday for a written recap on last week's episode.